Hello, my name is Dr. Rosslyn Ngugi. I'm a consultant physician endocrinologist. I'm also the Vice Chair of Kenya Diabetes Study Group, Assistant Secretary for Kenya Association of Physicians, and I'm also a Fellow of the ECORM College and part of the training committee. As a clinician, one of the problems we believe is that research is a completely different scope compared to clinical practice, requires a lot of work and input. And when I had met the team from Health Data Acumen, I remember meeting Dr. Boni Allen. He told me, you could do so much. You have so much potential in terms of the clients that you're seeing in your clinical practice. You could influence policy change, and yet you're not doing research. So I remember having this conversation and telling him, I don't have the time. And he's like, but just how much input do you think you require? And I remember telling him, when you start talking about statistics and research, I ran away. So he said, why don't you take a chance? It's not going to take long. It's going to take a year. We'll walk step by step. And at every point, if you feel that you don't understand, we'll go back. I took the ECORM training by Health Data Acumen, initially out of curiosity, but more of just trying to find out if there's anything else I could learn. And so it's been really exciting. It's been a very exciting journey going forward. One, I learned about this course that I found very interesting is self-discipline. You don't realize when you're a clinician. I wake up, I go to see my patients, there's no one who's keeping my time. But this forces you to take the time. You realize how much time you waste, that you could actually spend writing articles, doing research, and it's actually influenced my practice positively. So I am actually, would you believe, part of a group that is going to conduct a randomized clinical trial. I never thought I would actually be involved in something like this. For me, I really believed that clinical work was all that I was cut out to be. But you realize as you slow down in your career that perhaps part of the things that will give you more impact is how you're going to influence care. I think my message today, at the end of the day, about misgivings with regards to research, give it a try. I think the only thing that stops us from doing it is ourselves. So if you remove yourself as a stumbling block and you get access, Health Data Acumen has amazing people on the ground who are willing to walk this journey. Would you believe that even after the course is done, you can literally just call them and ask them, I'm thinking of doing this research, how would I go about it? So I learned that simple things like case reports is something that you could do. You could really write articles that I could be doing. And so recently I actually wrote an article in an Indian journal about obesity. And that just goes to show you that it didn't even take me more than 6 hours just to write it down. And even I was impressed at the level of work. So what are you waiting for? Can you join already? I know that they usually have 2 cohorts and they're reasonably priced. One of the things that I liked was that it was not too heavy on the pocket. So it's something that you could comfortably pay, and it's definitely worth the cost. So I would recommend it for all healthcare providers. If you have the chance, please grab onto it. It's definitely going to be a life-changing decision.